In the series of videos that I'm doing the two that are most closely related are depression and chronic pain. This video is going to be on the levels of depression, sort of an outline of how depression works. If you'll check on the reason and pain section, you'll see that I've outlined the levels of pain, you know, the pain chart from 1 to 10. I want to talk a little bit about how depression, just how it works and how to know what you're at, what level you're at, and what some of the symptoms are. My depression is comes and goes with two things. One, the level of pain, the level of the chronic pain that I have. If it's severe as it's getting now, I become more depressed. But the other, more important, and it really doesn't have anything to do with chronic pain, this is more like the depression that most people suffer, and that is my inability to work, to be as productive as I want to be. I'm doing these videos because I may not live long enough to finish the books that are in progress on chronic pain and depression, and some volumes on life and reason as well. So I kind of need to speed things up, and I want to leave a piece of myself. So this one is for people depression. Now, if you're in chronic pain and you're coming over to this, that's fine. You should be here because this is for you. But this is for anyone that's depressed. Now, here's the first thing. This is extremely important to know. If you're severely depressed, you're not going to be watching this video. And that's so. In a sense, these depression videos are going to be directed at the loved ones of the depressed, if the person is at bottom. And today I want to get to show you what bottom is. Depression can be caused by a lot of different things: a death of a family member that you can't get over, loss of a job, inability to be productive, which is the fundamental cause of my depression. And of course you have to recognize it and all that stuff. We'll get into the yada yada. I really need to write a book on depression because there haven't been any decent books written on depression. I know of a couple, and I'll probably mention those in later videos, but most books on depression are written by psychiatrists who aren't depressed, haven't been depressed. And if you haven't been to the bottom, and if you haven't struggled from the bottom back up, you can't write about depression. Because you don't know. You can't describe it. You have no way of articulating it. So, depression, it can come in cycles, but basically I want to talk about it as sort of like an inverted bell curve. Depression is, I probably should have a chart. Maybe we can put a chart with the fantastic people doing the graphics for these. So think of, it's going to look like this. Depression, like that. Okay? Like a bell turned upside down. So as you go down depression, life and loved ones start to become more distant. It's kind of like, you know, the cameras that they use for special effects where things get farther away but other things seem to stay the same, so that the person moves farther away from you. But the walls and the physical objects stay pretty much where they are. And you will know, that's sort of the going down. That's actually what the going down does. The world moves like that. Not the physical world, but the world of loved ones, the world of emotional attachments, the distance to the people that are friends and family moves away. You don't push it away. It just moves away. You don't have control over that. And that makes you more depressed because you can't stop them. You can, but that's for later on. You can at least ameliorate the problem. But you start lacking the tools, and you lose the tools more and more as you slide down the slope to be able to reach out, to be able to have that kind of communication. Because you don't want to communicate. I mean, chemically your brain, your psyche, your soul doesn't want to communicate. It's in a cocoon mode, and it becomes more and more encased. Now, the most dangerous part of depression are right before you hit the bottom, and then right as you come out of the bottom. So we'll talk about those in just a second. So we're sliding down, and then when you hit the bottom, what I've noticed when I've been at the rock bottom, of course, when I'm really rock bottom, I'm catatonic, and I've been there. That, for me, that's almost always associated with extreme pain. But I become almost catatonic. But generally speaking, what the bottom looks like is that the world becomes very sterile. Smells become sterile. Light becomes foggy. You'll notice actual physical changes. So the world now, people were becoming distant. Now the world starts to reshape itself as you reach and go through the trough at the bottom. The interesting thing about this and when you're at the bottom, you are pretty much unreachable. You can't express yourself. You don't really have a desire to express yourself. And I always tell people, and this is really important, especially for the loved ones of the depressed. The most dangerous time for your loved one is not at the bottom, because at the bottom, you'll know they're at the bottom because they don't want to do anything. Nothing. I become catatonic, but when I'm not quite catatonic, I just do nothing. Because you're dead. Your soul is dead, but you're still alive, and the world has no meaning. The world actually starts to look different, and people have no meaning, and it's like life in a vacuum. But the positive part is you're not going to harm yourself, because you don't even have the will to harm yourself. And that's why people who've been severely depressed, unless you've been severely depressed, you can't write about depression, because you can't possibly know what that bottom is. And also notice that when you're at the bottom, you're not going to be reading a book about depression, how to make yourself better. You're not going to be watching this video. At that time, depressed people absolutely need family for support, and the family has to be so strong, because there's no payback for the loved ones. The depressed person has nothing to give. And in my life, I've been particularly blessed, because the people have been able to love me through long periods of severe depression, and have kept my world from falling apart. And if you have a loved one that's depressed, know that you will have to sacrifice for that person. Their life is not in their own hands, so it has to be in someone's hands. Now, the dangerous part about depression, the suicidal risk, is right before you hit the bottom, or right as you're coming out from the bottom. And most particularly as you're coming out. I've found. Of course, I've been through this cycle a number of times, so people who are going through it the first time, or people who haven't really thought about it. This website, these blogs are called Life and Reason. For a reason. You need to think through these things. If you're depressed, you need to try them. You need to try to understand. You need to be able to reason. Sometimes you won't be able to, but the people around you need to be able to think it through to help you. Because you can't go blindly through this stuff. I could have never made this without... I think just being a philosopher immensely, because when I go through these things, I get some joy out of thinking about it and going, I've been through this before. Now, what's different? How can I control this? When will I lose control? And so I'm able to think. And people who are depressed you need to try to hang on to those things, because that's one very real thing. Another thing that helps you in depression is ice cream sandwiches. But they have a downside. You get big. Because I've been there too. I mean, about 3 cycles of depression ago, I was like 250 pounds, because my antidepressant of choice was Schwann's ice cream sandwiches. I don't think they're going to pay me for using that word. So, coming up on the other side is that's where the danger is, because you start to have willpower again. The world starts to become in focus again. You start the haze starts to lift. The literal haze that you see the world through starts to lift. People start approaching you again, and then but it doesn't keep moving. It can stall. It can fall back a little bit. And that's when so you're present in the world, you have a will again, you have actually willpower to do something. And if that movement stalls or starts to slide back, that's the most dangerous part of depression. And so I'll talk about things in greater depth and different strategies on how to address this stuff. But just know, if your loved ones are severely depressed, if they're at the bottom, you're all that they have. They also, will have things that you have to be on medication throughout this process. Believe me, that's absolutely important on antidepressants. But still, in day-to-day, in the physical world, in the non-chemical world, your loved ones and friends will save you. And I think that's enough about this little part. Thank you.